Since we set up the Head and Neck Cancer Foundation, we have focused on 3 key areas of development. Awareness, to increase people's knowledge of symptoms and available treatments. Training, to tutor cancer units around the UK, giving them information on groundbreaking treatments to help minimise invasive surgery and reduce deaths. Technology, to provide free state-of-the-art equipment to all cancer centres across the UK. In this short video, we explore how we have progressed in all 3 areas over the past few years. Our ongoing awareness campaign on social media and in the national press has been seen and shared by over 1 million people. Knowing what to look for when checking your mouth is crucial, as early diagnosis increases the survival rate by 90%. Put simply, our video has saved lives.
My name is Muriel Haggerty. I first noticed the symptoms in July last year. I came to see Mr. Wilson and he said he thought it was cancerous, which knocked the stuffing out of us. By September I had my operation. Said I would be in for maybe 10 days. I was only in 2. I would say to people, if you find a lump or anything, you've got to get it checked out.
With the introduction of sentinel node biopsy revolutionising the way we treat mouth cancers, we want to ensure that all surgeons, pathologists, nuclear medics and nurses are fully equipped and trained in this technique. Our training course for sentinel node biopsy, or SNB, is called the Head Start programme.
The Head Start programme was created by Professor Mark McGurk, one of our founders, and was designed by and for cancer training units. Our training and post-training support is accredited by the Royal College of Surgeons. In fact, every delegate that attends our course will actually receive 5 CPD points. There are 3 core components of our training: initial lectures, implementation, and continuous feedback. These trained teams are encouraged to begin sentinel node biopsy within their hospitals, initially combining it with the traditional treatment. And during this period, we provide clinical mentoring as a support. Once 10 cases have been performed successfully, then they're able to continue the procedure without this safety net. At this time, we provide completely free of charge the technology, a special fluorescent camera to the cancer unit for a year. This is a new approach to maintain quality and optimum success, which is groundbreaking in the treatment of head and neck cancers.
In the last 3 years, we have trained
23 nuclear medicine specialists,
13 pathologists, 62 surgeons,
20 theatre practitioners,
43 UK cancer units,
21 overseas cancer units.
Thank you.
Thank you.
thank you.
Thank you.
So what we've developed is a way of adding a second tracer, a visual tracer, so that when you're in the operation, you can turn on this equipment. We've injected an ICG, which is a fluorescent molecule. It moves in exactly the same way, goes to the nodes where the cancer cells will go to, and if we can take those out and check them, and they're negative, we know we don't have to do any surgery. Otherwise, everyone gets surgery. This equipment has been provided by HNCF, and it's been delivered here to Sunderland. So what you can do is you have this equipment. When you've started the operation, you can then point this down onto the patient, and in fact here we have a little fluorescent bulb, and when you think you're at the node or you can't really see where it is, you switch this on and there is your fluorescence. And that allows you to then retrieve the exact nodes that you want and to drop your failure rate. So we're trying to get our failure rates down to about 4 to 6%, and that's much better than current standards.
My name's Andrew. I first got this quite a while ago, and it was an ulcer on my tongue, and it was there for quite a while, and you just sort of ignore it. But then, because it wouldn't go away, I went to the doctor's GP. They referred me here, and I ended up having a biopsy, and it was an abnormal cell. When you mention cancer, it's like anything. It just hits you like a brick, I suppose. But I didn't even think about the lymph nodes and how they are filters and stuff. But Mr. Wilson then explained about this operation compared to a full removal, and it sounded a lot easier and has been.
This is just the beginning of our journey. With your help, over the next few years, we want to increase survival rates even further.